Hi everybody! Today we are going to learn about how easily to give an eye drop to a child or a baby. The first step, gather all the necessary materials first, as you need a fast application for the drop and an easier way. Make sure that you have within reach the medicine, tissues, and a pillow to be using to prop your child's head. Second step is to reduce distraction. Since the children are easily distracted, and since you want them to keep their gaze steady while applying medicine, make sure that there are no distraction in the room. This means that the TV shouldn't be on, nor should be there any nearby activities that will catch their gaze. Third step, explain to your child what the medicine does. That's of course if your child is old enough to talk. Explain in simple terms that you will be putting medicine in their eyes. Tell them, while it may sting or feel cold at first, it will help them feel better afterward. And don't forget to warn them about their vision. It will be blurry and discourage them from touching their eyes afterward. The fourth step is to put a drop on the back of their hands, and that to show them that the medicine is safe and harmless. While you are doing this, point to your eyes and tell them that you will be quickly dropping it there. The fifth step, show them how the drops will go in, and that can be done by using a harmless eye lubricant on yourself. And don't forget to promise your child a treat if they are able to take the eye drops well. Inform them that they must sit still and they cannot cry. If your eye drops are kept in the refrigerator, you have to remove them before application to come to room temperature. To quicken this process, you can roll the bottle between your hands until it warms. And of course, you have to wash your hands to prevent the spread of any infectious disease. If your child has crusty buildups around the eyes, you will first need to clean this area by a wet cotton ball or clean washcloth. Gently wipe the eye from the nose outward. Use separate clothes for each eye to prevent reinfection. Wash your hands after finishing. Place your child on their back and tilt their head back by putting a pillow under their shoulders so that their head drops back. Ask them to look up towards their forehead. If they are squirming or having difficulty keeping their gaze upward, you may distract them by holding up a toy. Ask them to focus on the toy to keep their eyes looking up. This will allow the medicine to run easily into the eye. Pull down on their eye lower lid. You must rest your fingers on their cheek and with extreme care, gently pull down the lid to expose the lower white of the eye. You want to create a small space for the medicine to enter the eye. Squeeze the prescribed amount of drops into their eyes without the dropper touching their eyes. Drop the medicine along their lower eyelid and their eyeball. In this method, you want to make sure it doesn't pull in the tear ducts along the inner corner of the eye. Ask your child to blink. They may need to blink once or twice. You could ask them to keep their eyes closed for 10 seconds before opening again. Don't forget to ask them not to rub their eyes. Wash both your hands and your child's hands. Now that the process is over, you should make sure that everyone's hands are clean to prevent infection spreading. And now, what about giving an eye drop to an upset child? Lie the child with their head between your thighs and their arms under your legs. This will help restrict the child movement while giving you free use of both hands. Don't sit on their arms, but apply gentle pressure with your thighs. This will also keep their head relatively still. The goal is to quickly drop in the medicine while they are restrained. Now, wait for their eyes to close. If they are thrashing and crying, it may be difficult to open their eyes. If they are not cooperating, you can apply the medicine to their closed eyes. Watch for when their head is still and their eyes are closed for longer than a second before applying the drop. Place the drops right in the corner of the eye closest to the nose. Use the prescribed number of drops. The drops will pull along the tears duct. Do this quickly as possible and they may not even realize that you have done it. Wait for the child to open their eyes. The medicine should roll into their eyes. If it doesn't, you can have the child tilt their head until it does. And now, wipe away the excess with a tissue. Gently remove any excess medication from the eyelid. Wash your hands immediately afterward. And now, it's time to learn how to give an eye drop to a baby. Swaddle the baby in a blanket. This will restrain the baby's arm. Lie the baby flat on their back. It is the easiest to place the baby on your lap. Make sure that their head is closest to you with their body extended out along your legs. Pull down on their lower eyelid. With a finger, press down on the skin below their eyes and gently pull it down. You only want to pull down enough to expose the lower whites of their eyes. There should be a small gap for the medicine to go in. Be extremely gentle as you do this. You don't want to upset the baby, nor do you want to injure them. Drop the prescribed medicine into their eyes. Bring the dropper within 1 inch to their eyes, but make sure that it doesn't touch any part of the eye, including their eyelashes. Squeeze the medicine along their lower eyelid as they blink. Watch to make sure that the medicine touches their eye. Apply the medicine while their eyes closed. If you are having difficulty putting the medicine into their eyes while they are open, you can try applying the medicine while their eyes closed. This can be done while they are asleep. Drop the medicine into their eye along the corner closest to the nose. Wipe up the excess with a tissue. Once you are certain that the medicine has reached their eyeball, you may clean up any excess that has dripped around their eyes. Use a tissue to gently remove the liquid from the lower and upper eyelid, eyelashes, and the cheek, and don't touch their eyeballs. Thank you.